I'm Summit Mayor Nora Radest. Good morning. I'm here today with Megan Avallone, who is the Executive Director of the Westfield Regional Health Department. And Megan has been a constant source of support and information throughout the pandemic. We're here today to talk about vaccinations for children and for adults. So we're ready to take any questions and share with you all the information that we have. To be honest, Megan has the information. So Megan, thank you for coming. Thank you for everything you've done for us for the last year and a half. And glad we're here to share this information today.
My pleasure, me too. So happy to be here today. Hopefully we can get some great information out to residents. Good.
Okay, so before we get some questions from the live broadcast, I have a few that we pulled from the our social media pages over the last week or so. Here's one. Are COVID-19 vaccines safe even though they were developed rapidly?
Yes. COVID-19 vaccines are very safe. People have to remember that even though the vaccines appear to be developed rapidly, the technology, the mRNA technology, actually took many years to develop. So the platform was there. So this isn't really a new vaccine. It may appear to be a new technology, but the vaccine is very safe.
That's good to know.
Okay, this is kind of a long question, but a few people mentioned this. Some people say that vaccines contain eggs, gelatin, latex, or preservatives, or metals such as iron, nickel, cobalt, lithium, and rare earth alloys or microelectronics, electrodes, carbon nanotubes, or nanowire semiconductors. Is any of this true?
So it's actually not true. The COVID-19 vaccine in particular, the ones that are on the market today, are preservative-free. So individuals who who prefer a preservative-free vaccine, this is a vaccine that might appeal to them. It does not contain eggs. There's no contraindication for egg allergy, and it does not contain any microchipping or anything like that. This is truly just a vaccine. The only thing that that we're interested in doing is protecting people from COVID-19. There's no, I know I've heard some people say, well, they heard there's a little bit of tracking in there. That is not true at all. It's really just to give your immune system a boost to protect you from the virus.
Okay. Here's another one. If I am pregnant or planning to get pregnant, is it safe to get the vaccine?
Yes. The American College of Obstetricians and Gynecologists recommend that every pregnant woman get the vaccine. Of course, we always encourage residents to talk to your individual doctor about vaccination, but it is definitely recommended. One of the things that we have seen in the health department locally is that we've seen a few cases where pregnant women have come down with COVID-19 and they're not sick enough to be hospitalized. So, they might have mild shortness of breath. But what we have seen happen at the health department is some of these women have gone into labor prematurely, which we know can happen in pregnant women. So even if you're not severely ill, there still can be negative effects to your unborn baby. Additionally, we know that pregnant women, generally speaking, have lower immune systems. So pregnant women are more at risk for those high-risk conditions that can be seen with COVID-19.
And what about if you're breastfeeding?
Yes. If you're breastfeeding, again, we always recommend you talk to your individual doctor, but it is recommended, and there is some evidence that immunity can be passed through the breast milk, which will help your baby as well.
Okay. Here's a question about second shots. This person did not get theirs, and 6 months have passed. What should they do?
So what we can say is that the COVID vaccine, the interval between the primary series, whether that's the 1-dose J&J or the 2-part mRNA vaccines, there is no maximum interval. So what does that mean? So that means for the Johnson & Johnson vaccine, you can get a booster anytime after 2 months. So it can be 4 months, it can be 6 months, it can be 8 months. You can't time out, but it can't be before 2 months. And for Moderna and Pfizer, it has to be after 6 months, but it can be any time after 6 months since the last shot.
Okay.
And what if they didn't get, they only got one shot, one Pfizer?
Yeah, so if you only got one shot of a 2-dose series. We certainly recommend that you finish that 2-dose series, and you can just go get the second shot at any time.
At any time, okay.
Okay. How long will protection from the COVID-19 vaccine last? And does it vary by age or weight?
So this is really interesting. Everybody is a little different, which is what we are experiencing now is that we know that immunity wanes over time. We know that some of the vaccines protect better than others. Moderna seems to have a higher protection rate 6 months out. Pfizer seems to have still good protection 5 months out, but a little less. And then Johnson & Johnson, the Janssen shot is even less 6 months out. Everybody's body, though, is different, right? These figures that we have for 6 months out are an average of all residents. The one thing that the CDC did approve recently is really recommending boosters for all individuals, because we just don't know yet who's going to have an optimal response past 6 months and who might have waning immunity. So any specific questions about your immunity, we always direct residents back to their individual doctor. But at this time, we are recommending that all residents who are 18 and above consider getting their booster shot, because it's certainly going to protect you better than that primary series.
One of the things we've been hearing is that people think you're going to get super sick with your booster shot. Is there any information that you have that supports that reactions are worse following the booster?
We have not heard that reactions are worse. We have heard that they've been a little less than the second shot, or about the same as your second or first shot. But one of the things that I would like to remind residents is that even if you were feeling a little not that great after your first or second shot, it's really important to remember this is temporary, right? It's a number of hours, as opposed to getting COVID, which could have you feeling really poorly for days or longer.
Okay. Do I need to wear a mask and avoid close contact with others if I am fully vaccinated? Does this vary by age? I am 35 years old.
Yes. So, listen, I don't like wearing a mask, right? I mean, nobody likes it. We've been doing it for so long, and we are so appreciative to the residents that are still doing their part. As you can see, the mayor and I are wearing our masks. We're both vaccinated. But it's really important, especially as we move activities indoors, right? We know that some individuals with COVID are completely asymptomatic, but they can still transfer the virus. And we know that there are some breakthrough infections, although they're rare. So I do think as winter approaches, it's really important, no matter what your age, that if you're around individuals, in a public setting, certainly crowded settings, that you do continue to mask.
Particularly when you're inside.
Yes. Specifically for indoor activities, exactly.
Okay. Now, since children get sick less severely from COVID-19, do they really need to get vaccinated?
I think the answer is yes, right? I think it's a myth that children get less severely ill. Children certainly have less deaths and hospitalizations, but they still can get pretty sick from COVID, right? They can still be not feeling well for a number of days with a high fever and other flu-like symptoms. Certainly children that have higher risk for complications are at risk for complications, things like diabetes and asthma. The one thing too that I really like to stress to parents about the vaccination for children is that getting them vaccinated is going to get them closer to their normal life quicker. So, for example, if you have a child that may be exposed to COVID in the classroom or through an extracurricular activity, at this time they still have to quarantine. But once a child is fully vaccinated, they no longer have to quarantine after they're considered a close contact. So what this means is that getting your child vaccinated is going to keep them in school and the activities we love, it's going to keep them there. And that's the ultimate goal of this, is to really get back to normal as quickly as possible.
So that's great, because that's one big problem, right? That your child has to quarantine, even though they have no symptoms or anything. They may not even have COVID, but they have to quarantine because they've been exposed. But now if they're fully vaccinated, they don't have to quarantine.
Yes.
That's good information.
And I have to say, you know, my children are young, right? One of my children is too young to be vaccinated, and I get it when parents are upset about the quarantines, right? I'm living the life right alongside you. My younger child in particular has quarantined more times than I'd like to think about. And, you know, I can't wait until she's eligible for vaccination because I really want her to stay in school and to stay in those extracurricular sports, because it's been a hardship on everybody this whole past year and a half.
Yep.
Okay. If my child gets sick after getting the vaccine, will they get me sick?
You know, it's really hard to say. There are some breakthrough cases, but again, they are rare. What we've seen is, you know, it really depends. But the best way to protect yourself from getting COVID-19 is to get vaccinated. So certainly, if your child gets sick, and they're around individuals who are not vaccinated, those individuals are much, much more likely to get COVID than individuals who are fully vaccinated.
Okay. Is there a fertility or developmental concern with vaccinating children before they reach puberty?
I think the answer here is no. You know, vaccines are something that we have using for, you know, many, many years to keep children safe. There's no evidence that the COVID-19 vaccines affect puberty or fertility, you know, and we would say really that, you know, that they are definitely safe at this time.
Okay. And then here's a question specifically about heart conditions in adolescents. This person wants to know if they should worry about heart conditions in adolescents and young adults that have been reported in the news.
So we do know that a very, very small percentage, primarily males, you know, tween to teenage years, young adults, that they can, as a very, very, very small percentage, get myocarditis and pericarditis, which are inflammations of the heart. The one thing that we know is that COVID-19 also can give you these same heart infections. What we know is that individuals after vaccine who get myocarditis and pericarditis, it seems to be a transient infection, which means it seems not to last long term at all. But what we also know is that individuals are much more likely, as I said, to get these heart infections from getting the COVID-19 disease. And when individuals develop myocarditis and pericarditis from COVID-19, from the virus itself, those infections stay longer. And those infections really can have devastating long-term effects. So we would encourage residents to definitely talk it through with your pediatrician. But again, this is a situation where we firmly believe, because the numbers are so small, that the benefit outweighs the risk. Okay.
How will vaccine safety be monitored among this age group?
So the same way that we monitor any vaccines in this age group, right? The CDC has a reporting system where physicians, healthcare providers, and parents can self-report any adverse effects, and then they are tracked in a national database.
Great. So will children under the age of 12 get a vaccination card?
Yes.
Okay. And then how do vaccine doses work for children? What if a child turns 12 in between the first and second doses?
This is a great question that we're asked all the time. So what we are saying is that the child should always get the age-appropriate dose. So if your child gets the first dose at age 11, they should get the 11-year-old dose. And then if they turn 12, by the time the second dose comes around, they should get the age-appropriate 12-year-old dose. However, parents can talk to their pediatrician about what makes most sense. If a parent chooses to get, to stick with the pediatric course, that would still be acceptable, but it is preferred that they get the age-appropriate dose at the time of vaccine.
Okay. My child is a very large 11-year-old. Should that make a difference in what dose he gets?
It really shouldn't. We always say that the child should get the age-appropriate dose. Even if you think of adults, right? There are some adults, especially when we are talking about senior citizens, right? The elderly population, they're very frail, they don't weigh a lot, and they've managed just fine with the adult dose.
Okay. Is it safe to get a COVID vaccine at the same time as a flu shot? for my child?
It is safe. You know, one of the things that the only thing that we've really seen is maybe increased soreness to the arm or soreness in both arms if you get one in one. But certainly, if it's convenient and you know you want to get both at the same time, there's no contraindication saying you cannot.
Okay. And then we haven't been getting any other questions during the live broadcast. So I have one last question before you can ask each other anything you'd like. Are some children more at risk for COVID-19 than others? Is this the same in adults?
Yeah, I think some children are definitely more at risk for more serious disease, right? And as I said, these are children who may be on chemotherapy type medications. These are children that maybe have diabetes, that maybe have asthma, you know, that maybe have organ transplants. Children who are more immunocompromised than others are generally more at risk for more severe disease. And this is exactly true in adults as well. One of the other things that we have seen in adults is that's a little, I don't want to say surprising, but one of the things that we've seen that's clear is a person's BMI also seems to have a direct correlation to how sick they get with COVID. So one of the things that we've seen is individuals, adults with higher BMIs tend to be more likely to get really sick with COVID-related disease complications.
Mm-hmm.